Somatic therapy is a great way to prepare people for psychedelic integration work. One of the ways that you want to prepare people if you're a somatic therapist is you want to get the client used to triumphantly meeting emotional responses. So really the basic white sauce of somatic work, you get them talking their way into their problems, you start seeing things spark up, you help them work through it triumphantly with the body. They experience this familiar pattern of tension moving into activation with a heightened heart rate. And then instead of going up into panic attack or flashback, they end up having this deep self-soothing or this opening up that's more gentle on the back end. And as they start triumphantly meeting these emotional responses, they start getting an expanded window of tolerance that puts them in a great place to do effective work. I've worked with people that have done multiple psychedelic experiences before doing therapy. They would, sometimes ill-fated personal experiments, sometimes illegal experiences. Then they do the somatic work and they get used to the idea of opening nature's energetic exhaust pipe. Then they go into their ketamine or some other sort of psychedelic work, and then on the back end, we end up being able to see these marvelous results. People being able to access the emotional responses and integrate the emotions, integrate their thoughts about things, integrate the physiological responses way more effectively. It's no longer an overwhelming prospect for them because they already were experiencing things, but then a lot of times after the psychedelic experience, now that they're triumphant over the negative emotions, they're now richly accessing deep positive emotions that were harder to get to before. So there it is.